Good evening and thanks for joining us tonight live at 11. You know, if you're one of the many that's hoping to snag a COVID test before you visit with loved ones over the holiday this weekend, finding one of those tests in time might be a little tougher than you expected. All across the country right now, we're seeing long lines at testing facilities and unfortunately empty shelves at pharmacies where these at-home test kits used to be. It comes at a time when doctors are now warning about the dangers of the Omicron variant and how easily this virus can spread. Almost every state has reported at least one case of the Omicron variant. And for tonight's big story, 13 investigates how hard it is to find a COVID test here in central Indiana. Verify looks into claims that this Omicron variant won't really get you that sick. Plus, we'll even show you what symptoms to look for this specific variant. But we start tonight by taking an inside glimpse at the military help that is arriving here at hospitals in Indiana. These are facilities that are overwhelmed, and they're concerned about the damage that Omicron could cause.
Navy personnel began arriving here in Indianapolis last night. More are expected to get here today, but the problem isn't just having enough staff. It's also having enough beds. At least one hospital here in Indiana has already begun converting ambulance bays and conference rooms to handle more patients.
In hospital intensive care units across Indiana, doctors say they have never seen it like this.
People don't seem to understand what's going on in hospitals in states like Indiana, and it is absolutely dire.
Dr. Gabriel Bosslet, an IU Health pulmonologist appearing on MSNBC, said they're treating some 14,000 patients, and that's before the even more contagious Omicron variant.
So if Omicron comes through, and even if it's less severe than the Delta strain, just the sheer numbers of people that it sounds like are going to be infected could very, very easily overwhelm us very, very quickly because we have no slack in the system.
You know, we've had a lot of questions about whether Omicron is really milder than the other variants and how common those milder variants are. So tonight, our Verify team takes a look.
The Biden administration is issuing a stark warning about the dangers of the Omicron variant.
If you're not fully vaccinated, you have good reason to be concerned.
At the same time, there are claims like these tweets sent to thousands of followers that Omicron only causes mild symptoms. So let's verify. Are Omicron symptoms always mild? Our sources are the World Health Organization, the Centers for Disease Control and Prevention, and the COVID-19 Advisory for Ontario, Canada. Many of the statements around the severity of Omicron are based on early data from South African researchers who first discovered Omicron last month, and the variant is just now starting to take hold in the U.S. However, the CDC says more data is needed to understand the severity of Omicron, especially in people who are fully vaccinated. The WHO agrees it's too early to make conclusions.
We do have initial reports that suggest that Omicron is less severe compared to Delta. However, if we have more cases mean more hospitalizations. And if a healthcare system is overburdened, people will die because they won't get the appropriate care that they need.
The WHO adds even if many cases are milder, as the early data suggests, Omicron is more transmissible than previous variants and vaccines are less effective against it. This increases the odds it will affect someone who will struggle to recover.
We do know that people with Omicron can have the full spectrum of disease, everything from asymptomatic infection, mild infection, people needing hospitalization, and people have died from Omicron.
Canadian health officials agree.
That's not sniffles. That is hospitalization, which is a very serious health outcome.
So it's false that Omicron symptoms are always mild.
So when it comes to Omicron symptoms, what do you need to be looking out for? Tonight, our Madison Stacy put together a list of the top 5 symptoms.
New studies released from areas where Omicron first appeared are giving glimpses into how the variant attacks the body. Early labs suggest the Omicron variant may not attack the upper respiratory system, so symptoms could manifest differently. One UK research app, which tracks people's symptoms, shows cold-like symptoms were prevalent in people who tested positive for Omicron. The top 5 symptoms reported were runny nose, headache, fatigue, sneezing, and sore throat. We have more on this variant at WTHR.com.
With the rising cases nationwide and a huge spike in demand for testing, President Biden announced plans today to mail free at-home COVID tests to anyone who needs one. Now, this is a new program and it's not going to start until next month. So what happens if you happen to need a test now? Well, today our 13 Investigates team discovered that getting your hands on an at-home test might be something easier said than done. So today our Sierra Putman called and she visited 8 stores and she was looking to purchase an at-home testing kit. Only one place that she contacted still had any of them in stock. And this isn't just a local issue here in central Indiana. Nationwide, for example, CVS is limiting online and in-store purchases up to 6 tests per person. Walgreens also capping customers to 4 tests because of the high demand and the short supply. Now, if the pharmacy near you happens to be out of tests when you stop by, 13 Investigates that you recommend that you keep checking back. That's because the shipments are steadily coming in. And if you're among the first to be there when they arrive, that is your best bet to snag one. Well, that wraps up tonight's big story.